a lot of women now are facing high risk pregnancies.
Baby was fine, pregnancy was fine, everything is okay. But when we delivered, the baby did not breathe. The offspring will be more likely to be diabetic in future.
What would be a safe time for a couple to go and visit a gynac before planning their pregnancy?
It is a high risk pregnancy because.
Welcome to Voice It with Karishma Shah.
Hello, my name is Karishma Shah. I'm a clinical nutritionist. Today, we're here to talk about a very important topic about pregnancy. And we have a very special guest with us today. We have Dr. Nupur Gupta with us. She is a director of OB and gynecology at the Fortis Memorial Research Institute in Gurgaon. And she's also the founder of the Well Women Clinic. Dr. Nupur, thank you for being a part of the conversation today with us.
Thank you so much, Karishma, for inviting me.
Today's topic is actually is of importance and high attention grabbing also, because a lot of women now are facing high risk pregnancies, and today you're going to be sharing your expert opinion on this whole topic of high risk pregnancies. So Dr. Nupur, what does a high risk pregnancy mean, and what are some of the early triggers for mothers who understand that there could be a chance of a high-risk pregnancy in my case?
Thank you. And so 95% pregnancies that happen are low risk, and they can happen in small centers, nursing homes. But yes, there are 5 to 10% of them that are high risk, which we need to identify on time so that we don't land up in trouble related to maternal health or fetal health, neonatal health, also the perinatal health. So high risk pregnancy we define when there is two kind of complications. One is any associated medical complication that is associated with pregnancy. And secondly, it is a pregnancy related complication, which is called obstetrical complication. So based on this, and sometimes even fetal complications will lead to a high risk pregnancy. And now once a lady has been labeled as a high risk pregnancy, her treatment, her management course will differ from person to person. So let us identify that who are those women who are called high risk. Yes. So firstly, talking about medical complications, it can be a pre-existing medical illness or any medical problem that develops during pregnancy. Pre-existing can be diabetes and hypertension, which is prevalent in most of the families in India, and we have a genetic predisposition as well. Other than that, Asian women and especially Indian women are overweight and obese and have lot of they are usually sedentary in their daily life, which adds up to this. Also, 1 in 5 Indian women have been reported to have polycystic ovarian syndrome, and PCOS is associated with some of the medical complications that we see, like diabetes in pregnancy or hypertension in pregnancy and so many others. Yes. Other than that, it can be a pre-existing kidney disease, liver disease, or any thrombotic disease, any history of thromboembolism, any brain tumor, or no matter cancer of any part of the body. And most of the women will also plan to conceive, or they may have history of kidney transplant or maybe history of liver transplant, and then they are planning their pregnancy. So yes, those pregnancies need to be monitored much more often. When we talk about obstetric complications, it can be any past history which is related to a bad obstetric history, which can be recurrent miscarriages in the first trimester, or recurrent pregnancy loss happening in second trimester, which is due to cervical incompetence, or history of previous stillbirth or an intrauterine demise, for which we don't know what is the cause, which are called unexplained intrauterine demises. There can be multiple reasons for that, but many of them remain undiagnosed. And when they come to us, sometimes there is congenital heart disease in the baby, and the mother says that baby was fine, pregnancy was fine, everything is okay. But when we delivered, the baby did not breathe, or fetal echo was done and we found a cardiac lesion. And sometimes there is no cause identified. There are some syndromes that run in families that are genetic syndromes, or commonly, which everyone knows, is the risk of Down syndrome. So that risk also sometimes recurs in the next pregnancy. Another thing is advanced maternal age. So nowadays, everyone is planning pregnancy at a later age.
Yes.
They, because marriage is late and career also has been given a priority. So most of them plan in late 30s. So advanced maternal age has associated complication. Other than that, pregnancy which is in teenagers, that is less than 17 years, is also associated with more complications, more chances of low birth weight babies, more chances of intrauterine growth restricted babies. And because they have been found to not be given proper antenatal care that they should receive.
Yes.
Other than that, antenatal care is not given priority in most of the small villages and towns, and they think that 2 doses of tetanus toxoid are more than enough to
Yes.
monitor a pregnancy, but that is not enough.
Yes.
Even WHO says that minimum 5 visits to the doctor are recommended during pregnancy. So
Yes.
during these days also, we have limited our uh, visits by patients to the doctors, but at the same time, but we are following them through tele or uh, teleconsultation online, and they have to be in touch no matter what is the circumstances, because pregnancy itself is a risk factor
Of
for
course.
many other illnesses.
Yes.
Other than that, if there is any previous history of mother having a previous cesarean, previous two cesarean, or previous pregnancy where there was maybe uterine rupture, or she had a fibroid removal surgery on the uterus, that uterus becomes high risk for a normal delivery, or previous delivery of with perineal tears or complete perineal tear, or previous delivery where bladder injury happened, or when there was development of a fistula. So there is a long list
Yes.
of high risk pregnancies that we see in our daily practice.
Yes. Thank you, doctor, for detailed information about this. I'm sure this is going to help a lot of people who don't really know about these things, before they start their planning. On the same note, doctor, what are some of the, precautions or tests or, any form of understanding for a couple to, understand when they are planning a pregnancy, if they feel that, there could be a chance of a high risk pregnancy with the mother. So if you could just help us with, some of your expert opinion on this.
Yes, Karishma. So there are some that can be identified when you are planning your pregnancy. So as obstetricians, as gynecologists, we would recommend that every couple who is planning a pregnancy in future should visit a gynecologist prior. There
Yes.
are some things which can be taken care of when you are planning pregnancy. Suppose there is you have blood pressure, but you never knew about it, because to diagnose blood pressure, it takes a long time. The symptoms develop very late. So your family history is important. You have diabetes or a pre-existing diabetes, then also that can be controlled prior. If you are overweight, we can manage that. That means your BMI is high. So
Yes.
if your BMI is high, you are more likely to have not only big babies, but also likely to develop gestational hypertension, gestational diabetes, and also the offspring will be more likely to be diabetic in future. So
Yes.
these are two things which can be monitored from medical point of view, other than their own personal history and family history. These two are important. Your genetic history, any history of offsprings or babies born with genetic defects, we should know prior. Any babies born with thalassemia, born with maybe hemophilia, which are blood disorders, that can be screened prior. So we do thalassemia screening also. Then we also do screening for viral infections, which are sometimes in our blood, but we don't know because there are no symptoms. For example, hepatitis B, hepatitis C, HIV, because these can also affect the baby. Even the rubella vaccine that we are administered during childhood has
Yes.
to be checked when you are planning pregnancy. If you are not immune to rubella, you can take the vaccine before planning. And nowadays, the latest recommendation which has been added is to also take the COVID vaccination even when you are planning your pregnancy. It will not affect your fertility, and it will not affect the baby also.
Okay. Thank you.
Other than this, we need to rule out anemia. We need to rule out any thyroid dysfunction that you might have. Thyroid is very common in this part of the country
Yes.
and usually remains undiagnosed due to many other reasons. Personally, if you are smoking, if you are alcoholic, if you are on any drugs due to whatever medical problem you have, that needs to be discussed. If you have had a heart surgery and you are on anticoagulants, we need to change that. If you are epileptic, you are on anti-epileptics, that needs to be changed. So all these drugs need to be discussed while you are planning pregnancy, because even alcohol, smoking, if you are not physically active, you should try and change your routine.
Yes.
And the list goes on. Yeah.
Thank you for again for that detailed information, Dr. Nupur. What would be a safe time for a couple to go and visit a gynac before planning their pregnancy? What is a good duration before time?
So yes, whenever you are thinking that you want to plan a pregnancy and you want to have a baby, best is to go 3 months prior, so that we can do minimum tests that are required. If you are anemic, that can be corrected. If you are vitamin D deficient, that can be corrected. If you are on some drugs, we can discuss those. And plus, also we can put her on folic acid supplementation, because that has been known to prevent not only abortion or miscarriage, but also prevents neural tube defects, which are very common, and they can be prevented. Also, for women who have had recurrent miscarriages, should be given folic acid supplementation when they start planning a pregnancy.
Okay. Okay. Thank you for that information, doctor. And coming to my next question, eclampsia is a common complication that we've seen in lots of mothers or lots of women who are pregnant. Can you throw some light on this condition? What exactly it is, and how does it happen, and how is a woman supposed to handle it if it happens to her?
Yeah. So preeclampsia is a condition where pregnancy is shown to have not only blood pressure, but also protein starts leaking in the urine. This is called preeclampsia, or pregnancy induced hypertension with protein in the urine. So
Okay.
any woman can develop this, even if you were not hypertensive prior. There might be women who are hypertensive prior to conception, that is, they have chronic hypertension, but they can have superimposed preeclampsia. Yes, the moment you have been diagnosed with preeclampsia, it is a high risk pregnancy, because there are chances that it will have implications not only on the fetus but on mother as well. So
Okay.
mother is likely to throw a fit, which is called eclampsia. Mother is likely to go into preterm labor because of the changes that are happening in the pregnancy. And sometimes this preeclampsia is of two types, mild and severe. And when it is not under control, maybe we need to deliver the baby once the fetal maturity has happened.
Okay.
As far as baby is concerned, baby is likely to have low birth weight, baby is likely to be growth restricted. And although babies of the same maternal age of mothers who have preeclampsia versus who don't have preeclampsia are more mature, their lungs mature faster because they live in a stressful environment. Sometimes the fluid around the baby also reduces, so they have more chances of developing fetal distress, not only during pregnancy but in labor as well. So sometimes likelihood of going into cesarean sections or emergency cesareans is a more possibility for these women. It is seen in almost 10% of our population.
Yes.
And when such women have eclampsia, it adds to not only maternal morbidity but mortality also of the burden of India that we see per 100 live births. So, but this is a preventable condition. It can be controlled well in time. So it is very important to know what is the weight gain that mother has during pregnancy,
Okay.
and other than that, what is the blood pressure at every visit. So nowadays these two things are compromised, but what we advise is that to have weighing scale and to have blood pressure instrument at home.
Yes.
And also women to watch for signs of preeclampsia and eclampsia, like blurring of vision, constant headache, epigastric pain, or swelling all over the body, and especially swelling in your lower limbs, or
Okay.
in the foot or ankle edema is sometimes a sign, a rapid weight gain. And sometimes when there are these symptoms, we also come to know by some of the blood tests that get deranged. There can be deranged liver enzymes, there can be hemoconcentration, there can be low platelet counts, and it can affect mother and fetus both. And when mother throws a fit, this is a life-threatening emergency.
Okay.
And sometimes even there is brain hemorrhage due to this.
Oh, okay. That's a lot of insight, doctor. I'm sure a lot of women out there, in the age of planning a child, or maybe in a thought of, maybe whenever they do want to become mothers, they don't have this kind of information. So thank you for telling us all these things. And Dr. Nupur, so coming to our last question for today, could you tell us some critical self-management tips for women who are planning their pregnancy, and they might have an inclination that there could be a high risk involved in their pregnancy, so maybe something that they can follow as a routine to minimize the chances of their high risk pregnancy? If you could help us with some tips for this.
Yeah, so thank you, Karishma. We know, as I told you, that 95% pregnancies are low risk. And what we can do to identify or maybe to prevent such complications is to have a regular gynecologist where you go to her, you meet her, you discuss with her your family history and your personal history both.
Yes.
Try to have a normal BMI, be physically active as far as possible, not only prior to pregnancy, but during pregnancy. It
Yes.
is very important to have, to be able to move as much as possible, because that will prevent excessive weight gain to mother. It will also prevent overweight babies. Sometimes obesity has its own complications, not only during pregnancy, but after delivery as well.
Yes.
And the problems that develop during pregnancy, sometimes they are genetic. The environmental part we can take care of, and to be well hydrated, to have good sleep, try to maintain your mental health hygiene, which is very important during pregnancy, because pregnancy, no matter how exciting it is for you and your family, it brings with it, it brings also a lot of stress and anxiety when the pregnancy test comes positive. Every moment there is some stress. My blood test will not be right. Maybe my ultrasound is not okay. What will be my level 1 report? In level 2, this is showing, what should I do? And there is lot of rushing around here and there, and a lot of panic, and that can be avoided. Don't take too much negative news for whatever it may be. Don't hear negative birth stories, which will add to trauma in your own life, because every pregnancy is different, every body is different, every mother is different. Experience for everyone will be different, whether you have a normal delivery, whether you have a cesarean delivery. But to keep yourself positive
Yes.
during these 9 months will make all the difference. You can fight it out, not only yourself, but with your family, with your doctor. She will always support you. Try to make a birth plan whenever you conceive, that how things will go, what are the changes you will see, how many ultrasounds you will need, how you will be monitored, how many times you need to visit the doctor, who will be your doctor, where you will deliver, where will you go if emergency happens. So
Yes.
if lot of things are made clear in the beginning, it will not add to additional trauma that you face during your pregnancy. So choosing your doctor, having a good rapport is also equally important. And
Absolutely.
not to rush that I have been diagnosed with a high risk problem, so I need to change my doctor, and I need to see a doctor who is specializing in twins. I need to see a doctor who is specializing in blood pressure. Most of the doctors that you have in India are very well trained. They are highly professional. They have seen all ups and downs.
Yes.
I think Indian obstetricians see everything, whatever is written in the textbooks. They are well experienced,
Yes.
so you don't need to worry, and they will take help of their colleagues. If required, they will discuss and they will fight for you no matter what.
Yes, that is absolutely brilliant, Dr. Nupur. Thank you for such beautiful insights, and what you said about the management part of it. I absolutely agree with you. That is something that so many young mothers who are planning their pregnancy, maybe their first pregnancy, maybe their second pregnancy, as you mentioned so nicely, to have certain things pre-planned and to be aware about it, conscious about it, and just know those things reduces so much anxiety over those 9 months. Thank you for all this, lovely information that you have shared today, all the medical complications also that you told us about, the tips and the precautions that every woman can take. I would like to thank you once again on my behalf for doing this conversation and for giving us all this information today.
So thank you so much, Karishma, for giving me this opportunity and allowing me to speak on a very important topic. Thank you.
Thank you.